The next session is an update on live surgery, and I'd like to introduce Dr. Boylu, who will be giving that update.
Good morning. Welcome all. I hope you enjoy your time in Istanbul. My name is Dr. Uğur Boylu from Ümraniye Teaching Hospital, Istanbul. I will present the highlights of the live surgeries from yesterday. Can I have my slides, please? We watched 5 excellent endoscopic lower urinary tract procedures. Dr. Sancha did a XPS laser vaporization. Dr. Errol did a diode laser vaporization. Dr. Teveo did a whole lip. Dr. Mato did a bipolar TURP, and Dr. Herman did a bipolar enucleation. Dr. Mato performed a bipolar TUR with Olympus resectoscope. He used a 12-degree telescope. Settings were 200 for cut and 120 for coag. Resection was performed with a medium loop electrode, and button electrode was used for vaporization. Dr. Mato addressed that he removes Foley catheter usually after 24 to 48 hours. He used vaporization to smooth the edges after resection of both prosthetic lobes. Dr. Hamann from University of Hanover performed a bipolar enucleation. He used a 30-degree telescope with a 26 French continuous flow resectoscope. He performed resection and enucleation of the prostate. He advised to resect the median lobe first, mobilize the apex, and then enucleate. Dr. Sancha performed a laser vaporization of the prostate with the 180-watt KTP laser. The new fiber is capable of 650 kilojoules. He defined surgical dose for laser vaporization as power time divided by area. He advised to vaporize 3 millimeters away from tissue without touching it. Excessive coagulation should be avoided. As a sign of good vaporization, one should see big bubbles. As a beginner tip, Dr. Sancha suggested to use a transrectal ultrasound to assess the remaining prostate tissue. Dr. Errol from Istanbul performed the diode laser vaporization. He stated that diode laser has a 980 nanometer wavelength. The laser generator is a lightweight and very portable. He used a side-firing optical fiber with a 70-degree deflecting angle. Dr. Errol addressed that diode laser vaporization is easy to learn and very well tolerated by patients. And finally, Dr. Teveo from England performed HOLEP with a 100-watt laser. He addressed that HOLEP is superior in many ways to its alternatives, proved by several randomized clinical trials. He started with a hockey stick incision and recognized the prosthetic capsule. He reminded that the laser fiber should remain on the rim of the bladder neck. Turning down to 80 watts provides nice coagulation. He reminded that the bladder must be full during morcellation following enucleation of the prosthetic lobes. And as a follow-up, all patients are doing well. No problems has occurred during the night. And that'll be all. Thank you.